Hi, my name is Rupert Raj. I'm a trans man. I've been a trans activist across North America since 1971. I'm also a gender specialist, a psychotherapist, a gender consultant, professional trainer, and a published clinical researcher. And so I've been at Sherburne Health Center coming up to 11 years as a mental health counselor. I do individual, couple, and some family therapy for queer folks, as well as trans, genderqueer, gender nonconforming, gender questioning, and their loved ones. And through my private practice, my part-time private practice, RR Consulting, I also do counseling and consulting for those client populations, and I do readiness assessments for hormone therapy and or for sexually examined surgery, so I can provide clinical assessments to physicians or surgeons for those individuals. So Barb asked me to talk about what I know best, so I'm going to talk about mental health issues and follow up a little bit from what Nicole was talking about, which I was also on the Trans Pulse project as one of the initial investigators. It's a wonderful project, please check it out. So as Nicole was saying, there is a higher risk of suicidality and self-harm for marginalized communities, including lesbian, gay, bisexual, transsexual, transgender, intersex, and two-spirit people, including, of course, gender nonconforming and gender independent youth, children. There is a fairly high incidence also of mental health issues, including depression, anxiety, post-traumatic stress disorder, anger, lots of anger out there. And often also guilt or shame, as well as social isolation, homelessness, poverty, etc., as I'm sure you're all aware, those of you who work with those individuals. Now this is especially true for LGBTI youth, many of whom are kicked out of their homes or who decide to run away from non-understanding parents, and many of whom are expelled from school or who decide to drop out, and many of whom find themselves on the street or in shelters, often involved in serious alcohol or drug use, crack, cocaine, crystal meth, etc., and at times conflict with the law. I know this from personal experience because I transitioned to male when I turned 19 in Ottawa in 1971. Fortunately, even though my parents had just died in a car accident 3 years earlier, I had two critical supports: my younger sister and a trans-positive psychologist at the Royal Ottawa Hospital, who helped me to develop positive coping strategies and resilience, so that myself, I was fortunate enough that I did not have to resort to less healthy strategies such as drug use, cutting, or trying to take my life. A good resource, if you don't know it, is Kate Bornstein's Hello Cruel World, 101 Alternatives to Suicides for Teens, Freaks, and Other Outlaws. Please check that out, it's a wonderful resource. The reason for these negative coping mechanisms, such as self-harm and suicidality, problematic substance use is, as you probably well know, is referred to as social determinants of health, such as homophobia, transphobia, genderphobia, racism, sexism, classism, ableism, ageism, and so on. As mental health clinicians and clinical social workers and other allies and supporters as appropriate, you can support your LGBTI youth clients by helping them to build an effective support network, including clinical and community resources, and also by helping them to develop the life skills and positive coping strategies they will need to survive and thrive. Some of these, from a clinical point of view, may include narrative therapy, existential therapy, dialectical behavior therapy, also known as DBT, something called the gratitude practice, mindfulness practice. A number of you are probably familiar with mindfulness. Also mindfulness-based cognitive behavioral therapy, acceptance and commitment therapy, or ACT for short. It's a kind of a mindfulness-based CBT. And brief solution-focused therapy, and of course, this isn't an exhaustive list of therapeutic modalities. I wrote a paper in 2008 called Transforming Couples and Families, a transformative therapeutic model for working with the loved ones of trans-identified and gender-divergent people in the Journal of GLBT Family Studies. It's on a resource listing on my private practice website if you wanted to access it. And in this paper, I schematized my continuum of denial to acceptance to celebration, in which I outline the 7 stages of the process from denial to hopefully acceptance, and perhaps even celebration, by parents, partners, children, and other loved ones. These 7 stages are denial, acknowledgement, tolerance, acceptance, integration, appreciation, and celebration. This is roughly based on Eli Coleman's continuum for gay and lesbian folks coming out, which he wrote many years ago, in the 70s, I believe. This psychoeducational tool can be useful for clinicians supporting families or partners of trans or gender non-conforming youth by normalizing and validating the staged process of acceptance. So it's a process. Our loved ones are going through a process of accepting us. We do often see newcomers from different ethno-racial backgrounds who are having a hard time accepting their trans and genderqueer and gender non-conforming children, whether they're Muslim or Christian or Jewish and so on. And we'll see this also in the Children's Aid Society with foster parents. So it is a challenging area where we have to delicately navigate and negotiate different diversities. I also encourage you, clinicians and service providers, and other allies and supporters, teachers, guidance counselors, school psychologists, parents, and so on, to advocate for your clients and your youth, because you are in a powerful position in some cases, particularly if you are a doctor or a social worker or a principal or so on, to liaise with and or mediate with the appropriate stakeholders. So these could be parents, school officials, and other providers in the circle of care. My colleague Max Kearney and I submitted a paper, hopefully to the next CPATH conference, which hopefully will be in early 2015. It's called Walking the Razor's Edge, Balancing Client, Community Advocacy, and Clinical Practice when Working with Trans, Genderqueer, Intersex, and Two-Spirit People. A lot of the work I do at Sherburne is around advocacy, and it's not always easy to put yourself out there to advocate for your individual clients or your client populations when you're a clinician, because in some cases your agency may not support those efforts. Well, in some cases they might. We're pretty good at Sherburne in that respect. So I just want to share a couple of resources with you. I have a resource on my private practice website, rrconsulting.ca. It's called Resources for Parents, Partners, and Children of Trans People and Gender Non-Conforming Youth and the Providers who Support Them. So I try to update it every so often. So I've updated it this year, so you can check that out. There's some support groups, videos, books, articles, chat lines, and so on. And there's some other web links, which Nicole mentioned, the Trans Pulse Project, a really good one. There's also CPATH and WPATH, which I believe Barb has put in your package. And Rainbow Health Ontario, of course, and LGBTparentingconnection.ca, which is a partnership between Sherburne Health Center and the 519 Church Street Community Center. There's also the Supporting Our Youth, or known as SOY, S-O-Y at Sherburne Health Center, which is a great resource, and you can check out Transfusion Crew there, the Gender Journeys Group, and a whole bunch of other stuff. Okay, I guess my time's up.
Thank you.